Welcome to Stay Tuned. I'm your host, Casey Nolan, and tonight we are talking Obamacare and small business. So if you own a small business, if you work for a small business, or if you would just like more knowledge and less nonsense in your understanding of the new health care law, well, tonight's show is for you. We've got a lot to talk about, so stay tuned. All right, we're getting started in studio tonight with Thomas Graney from St. Louis University's Law School to help us kind of frame this conversation. Let's talk about the aspects of the Affordable Care Act that pertain to small business. What are those aspects specifically targeted towards small businesses in the new health care law? The
most specific programs in the Affordable Care Act are, first of all, creating exchanges that are specifically designed for small business, the so-called shop exchanges. And those are places where small businesses will be able to post for their employees a range of insurance products
Give them some options
that they can choose from. And for small businesses, this is a big deal because the big problem small businesses face is they're small. And they don't have a lot of people to pool their risks with, and consequently, they pay higher prices. They pay as much as 20–30% higher than businesses that have more employees. So that's one big program directed specifically at small business. Another is to subsidize the cost of insurance for certain small businesses. Now that program's directed at the smaller of the small businesses, those with fewer than 50 employees, and with relatively low payrolls, an average payroll of 50,000 or less. And again, the idea is those are the businesses least likely to be offering insurance today and most in need of help. So those are the two major programs that are specifically directed at small business. But there are a variety of other programs in the Affordable Care Act. So some people have called it a hodgepodge because it tries to do a lot.
So, okay, so let's talk about that for a second. So there are components that are not directed specifically at small businesses. Are you saying there are other things that will indirectly help small business?
Yeah, you know, just by way of background, I think when Congress looked at health care insurance, it found two groups that really were getting the short end of the stick. First and foremost, of course, were individuals who had to buy on their own. And that's why it set up exchanges in the first place, for them to have a range of insurance products to choose from. But the other was small businesses, and they pay higher rates for a variety of reasons. They have to pay brokers, they have few insured, so hence they have bigger risks and insurers charge them more, and they have other higher administrative costs. So Congress was very attuned to their needs, and it tried to focus on them specifically. But the larger picture for the ACA is it tries to do a lot of things, and some have called it throwing spaghetti against the wall, but there are a lot of cost containment ideas that are being tested in pilots, other kinds of new ways of doing healthcare, fundamentally aimed at changing the delivery system. Now, nobody knows how many of them will work or when they'll work, but it's fair to say they're trying a lot of things. To the extent those things work and do lower costs, that's going to help small business a lot. And a second way small business can be helped is by indirect means. A lot of people today suffer from what they call job lock. They're in a job and they're staying in that job for one reason, and that's to keep health insurance. They might be better qualified for another job. They might want to move out to another job, but they're stuck because of health insurance. To the extent the Affordable Care Act says to those people, you know what, we're going to make affordable health care available to you as an individual on an exchange, they'll have an opportunity to do that. That could help small business in various ways. It would help those small businesses that decide not to offer insurance. In other words, they can now hire employees who might not otherwise move because they can find affordable care on their own in the individual market. So there are these indirect benefits that can accrue through the Affordable Care Act that potentially could be very helpful.
Of course, not everybody is convinced that that's going to be the case, that this is going to be a net positive. And a couple of numbers I want to ask you about that you hear about when folks are concerned about the impact of this law. 49ers, 29ers. Let's start with 49ers. Right. Why is the number 49 important?
Well, importantly, the Affordable Care Act mandates insurance coverage for employers who have 50 or more employees. But you don't have to have coverage if you're under 50. So 49 may be becoming a magic number. You can't stick to 49. You're not mandated to have insurance. And again, Congress was trying to take care of employers who were probably less equipped to take on insurance. So that's one way in which the market may react. And anyone who tells you they know how the market's going to react is probably kidding you. But there certainly are strategic and rational things for employers to be doing. They may go that direction, they may not.
They may actually hire, or may not. We've heard people say they may not hire that 50th employee.
Right. And the 29ers, I guess, refers to the fact that at least to some extent, there's the possibility that employers will decide to take on more part-time employees, and 30 hours is the magic number for part-time versus full-time, so they might hire more part-time people in order to avoid having to insure them. There's a lot of those possibilities, and nobody knows quite how it'll play out. But I can at least say we've had some of this experimentation going on in a laboratory back east called the state of Massachusetts. And people predicted a lot of things were going to go wrong in Massachusetts. But in fact, it didn't happen. It didn't happen. In fact, employer coverage increased in Massachusetts after the reform was passed. And they have relatively small penalties and generous subsidies. So Massachusetts is at least a laboratory where some of the more dire predictions didn't occur. So nobody's sure what's going to happen, but at least there's some grounds for optimism out there.
Very good. Thomas Graney, St. Louis University Law School, thanks for starting us off tonight. We appreciate it.
Thanks for having me.
Thank you for your time. Okay, we want you to keep your cell phones out, your laptops out, and your iPads on during the show tonight. And here to tell you why is Mr. Ed Reggie. Ed?
Thanks, Casey. Well, I am going to be asking, just like Casey said to you, to bring out your iPads, your iPhones, your computers, and interact with us tonight. And we've made it easy for you by using Facebook or Twitter. And I'm going to be the one responding and listening to your comments and using them throughout tonight's show. You'll see them throughout the show on these screens right here, and they'll be on the monitor. In fact, we put out this question earlier this week. What does Affordable Care Act mean to you? And how does it affect small businesses? And many of you responded with questions. And so a lot of tonight's show is shaped by your responses, and will continue to be shaped throughout the night with your tweets. And we made it easy. You can log on to our Facebook page by going to the Facebook page, the 9 Network, or you could use the hashtag, you see it right now on your monitor, Stay Tuned STL, and send us your questions throughout tonight. Let's see what you are already saying.
Okay, we're staying in the studio. Now we're over at the table with some folks who work in this field and know this issue backwards and forwards. Let me do some introductions first. Jen Bursdale with Missouri Healthcare for All. We appreciate your being here. Chris Risker, Webster University. Thanks for your time as well. And Emily Brimmer, Brimmer Conley LLC. We heard the word broker mentioned just a minute ago, and that's what you do. You help small businesses find these insurance policies.
Yes.
We just saw some tweets there, and I think from what I was able to see, it's already definitely not an issue. We already know this. This divides people. We have a lot of different opinions on this. Why? What are some of the primary concerns that small businesses have about this law? This is not popular with everyone I know.
So I can jump in and talk a little bit about what this means to everyone, including small businesses. Missouri Healthcare for All is committed to the principle that every Missourian should have access to quality, affordable health care. And to us, the Affordable Care Act tries to address some of the shortcomings we've had in our healthcare system. And as you mentioned before, small businesses have been one of the groups most affected by the problems. So I know of small businesses that it's hurting their budget and their bottom line every month because they make the commitment to provide health insurance to their employees. They're able to make it work, but it makes it a lot harder to keep their doors open. I know small business owners who are putting off important personal health treatments that they need because they're afraid of losing their own personal health insurance. And people that unfortunately have had to leave small businesses that they really loved because they had to go to a job where they could get health insurance benefits. So a system that's going to make it easier for small businesses to provide health insurance and for small business employees to get their own health insurance if they don't get it at work, I think will help small businesses and their employees.
But not everybody thinks it's going to be easier.
Yeah, I think one of the problems that we're having with this is what are the costs going to be for the small business, and particularly with the exchanges, it's a little bit of a black box. We really don't know what the costs are going to be associated with, or even how they're going to be able to drive competition between the various insurance companies. So I think, and as an entrepreneur or a business owner, you want to know very certainly what your costs are going to be for the next 3-5 years. You want to be able to write that down. You want to be able to account for it, and right now they can't.
Right. Planning is a big problem with what employers face right now and what they will continue to face with the law. I mean, the employers that I deal with every day, the biggest struggle is cost. So to what Jen was saying about how unaffordable things can be for small businesses, insurance brokers in the insurance industry, and I don't work for a large insurance company. I'm a small business owner myself. I'm an independent advisor that works with businesses on trying to develop their planning and works with employees directly. They're really struggling with the cost of this, and they don't see the ACA as improving that, to be quite honest. A lot of them are about to get a big wake-up call. Now, if you have employer groups that are an older demographic, that have some significant claims issues that have been driving their cost, they might see some help from this community rating system. However, younger, healthier, and primarily male groups could get a major rate increase from this. On top of the cost of the premiums, though, you also run into issues with compliance. Compliance is a big problem with ACA because employers were struggling, particularly small businesses, were struggling to meet all of the compliance requirements that they had before under laws like COBRA, and now you just compound that exponentially.
Are you talking about businesses kind of doing what we talked about there with the 49 and the 29 and finding ways around it, or are you talking about a different compliance issue?
Well, both are actually issues. So on the one hand, you have the compliance issue of now they have these summaries of benefits and coverage that have to be given out within certain timelines. They get these MLR rebates, but they have to figure out how to distribute them, and they're getting very little guidance on that. There's more rules that they have to comply with ACA than what they had to before. With the 49ers and 29ers, though, you do have companies that are looking at restructuring how they hire and their employees. Maybe they don't hire that extra employee. Maybe they convert folks to part-time. The first 30 people that they have full-time, if they're subject to the penalty, they get for free. So if they can convert more of their population to part-time, they could avoid the penalty and potentially drop their plan altogether. One other thing that we're seeing, though, too, that's coming out with this, the regulatory guidance that came out on the affordability test, you can't get the subsidy in the exchange unless you either have no insurance, the insurance doesn't meet the essential benefits test, or it's deemed to be unaffordable. So, but the unaffordability rule is based on, is the cost of your coverage for you, the employee, more than 9.5% of what your employer pays you for the employee-only benefit.
Okay, wait. So say I think I followed that. Say that
Sure.
one more. Say that one more time.
Okay. So in order for coverage to be deemed affordable,
right?
Okay, it has to be less expensive for the employee than 9.5% of what they earn for their employer for their job against the cost of what the employee-only premium would be. So doesn't factor in what it would cost for spouse or children, just for them. If it is deemed affordable and if it meets the essential health benefit, they can't get the subsidy, which is fine, except for what if employers, in order to contain the costs and to get things affordable, switch those contributions over from the dependents that maybe they were contributing for before over to the employee to get the employee in that affordability zone. Now they don't have to worry about the penalty because all their employees have affordable coverage, but the spouse and the kids are not going to be able to qualify for subsidies on the exchange, which could make it very unaffordable for them.
I think we've established there's definitely some job security for someone like yourself who understands all of this. But is that part of the I mean, that's not simple, what she just described. Is that part of the problem of getting the message out or getting some buy-in here?
Well, I think it is. I mean, it's a very complicated law. It does have some wonderful benefits in it, most certainly, and you can take what she had to say and balance that against the fact that it's been very hard for small businesses to get any kind of insurance. The fact that if the exchanges work well, theoretically, if they do provide the right kind of competition, and there is a sufficiently large pool, then it would appear that small businesses will be able to get health insurance at a much lower rate. So it's, it's a balancing game.
Small businesses, though, are already pooled. I mean, I guess my question is with particularly the shop exchange. I totally get the individual exchange. You have millions of Americans trying to get enrolled in something from October to December, which also happens to be Medicare open enrollment season, as well as the insurance broker's tax season, because it's when the bulk of the employers have January 1 renewals for their employee benefits. So it's a crazy time, having an exchange to provide a portal, a pathway for Americans to be able to easily get in and get the coverage, I think is a value. But with the shop exchange, these small businesses, they're already in a pool. Now, their claims are factored in terms of adjusting them to where the pool is, but they're not priced on claims alone. I mean, far from it.
Jen, we have 1 minute left. I've let the conversation get away from you just
Sorry.
a little bit. No, not at all. No.
There's a lot of important and interesting issues that have been raised, and I think one of the things we're really seeing right now is we're in a little bit of a period of upheaval. The changes are coming, the exchanges are coming, the plans are coming, but we don't have them yet. And so we hear a lot from a lot of different people. A lot of people are speculating about what the market will do, what the costs will be, and some of that we just haven't seen yet. What we know now is that the system isn't working. It's been unaffordable for small businesses. It's driving employees away from working for some of these small businesses. And something interesting that happened last year was we had small businesses in Missouri alone get $38 million in rebates because insurance companies hadn't met the standards set by the new law for the amount that they had to spend on medical care. So that's already money coming back to small businesses. I think we all need to watch for whatever issues need continued work, but I think the system clearly needs to improve, and I'm really excited to see things get going. Okay,
the plan is we're going to stop the conversation for now, but we'll bring you all back at the end of the show. We'll hear more from you. We also, and who better to talk about healthcare and small business than small business owners? We have them coming up, but first, our Margie Enright found a man who believes healthcare is an investment that is good for his bottom line.
As my partner says, a classic Horatio Alger story. We had 3 crates of records, 300 records together, rented a booth for $20 at the Soulard Farmers Market. We sold almost everything. We sold like 300 records at $3 a piece. And suddenly we had $900. This was a huge amount of money. And we went and bought a whole bunch more records.
Lou Prince has turned those 3 milk crates into the largest independent music store in the Midwest, and that has taught him all about assets and investments. But as he sees it, vintage vinyl's most important ones are its people.
St. Louis is an exceptionally musically literate town. So I need a consistent workforce of very educated, very knowledgeable people who are also patient.
I'm a Drive soundtrack on vinyl that we have one of.
And Lou has his ways of keeping them around.
We provide 100% paid for health insurance. And we do it outside of, we have a very small deductible, $10 deductible on office visits and $10 on prescriptions. And that's because we really want people to use the health insurance. We also do it for your entire family.
When my wife and I got married, one of our big decisions was which health plan were we going to be on, my employers or her employers. And at the time, she worked for one of the biggest companies in Missouri, and we ended up being on the Vintage Vinyl Health Plan because it was a better plan.
This is my primary retention tool. It saves me tens, if not hundreds of thousands of dollars in retraining people, in bringing in someone new, finding someone who can actually do this job.
Which appears to be working.
I can't get rid of anybody. People use it, people like it, people feel like they have a unique tie to the company.
Jim Utz has been working here for 23 years.
When I first started working here, I was straight out of college, so I was still under my parents' insurance. And then all my friends were like, oh, we're going to have to find jobs with health insurance. So it definitely took that fear of like, oh my gosh, I'm going to either have to not get sick or I'm going to have to find a job that will cover me if I get sick.
Many small businesses struggle with decisions about health care.
I think small businesses, the cost of providing coverage for themselves and their employees, they pay about 18% more than large businesses on average, and that's left about 28% of small businesses, defined by Kaiser, a Kaiser study as 25 and under, it's left about 28% of small business owners uninsured.
The problem is, as a small business, we've had to have larger and larger and larger deductibles in order to afford the monthly premiums. And so I'm gambling more every year.
And with the passage of the Affordable Care Act, many businesses, big and small, are thinking about health care more than ever.
The information around the Affordable Care Act was, up until it was upheld by the Supreme Court, and then through the elections, there was a lot more discussion about whether it would stay a law or not, as opposed to what's in it. And there were a lot of provisions, or there were a lot of portions that were already in effect. So what we've been doing and what small business owners can learn now is they can amend their tax returns back, and they haven't missed out on those provisions. And then moving forward, we've seen a huge increase in folks wanting to know what's happening. Small business owners want to make sure that they understand the benefits in there. They want to understand if they have any obligations.
For small business owners who provided insurance to their employees, the impact is already evident.
When I went to shop for insurance the first year, for the first time after the ACA was passed, I got more insurance for less money. It was a miracle. It turned out that the ACA had set a basic level of coverage that had to be in the plan, and that it had somewhat regulated the price.
And yet some of the biggest changes under Obamacare haven't even taken effect.
The shop exchange is going to go live in 2014. It'll be accessible to employers. They'll be able to go on and shop for insurance for their employees. If you look at a small business now and an insurance company they assess the risk on, say, the 5 or 6 employees that work at that business. By purchasing through the exchange, you're pooling with all other businesses. They're generally going to be businesses 50 and under.
But the connection between career and healthcare is nothing new.
Folks who've been suffering from something called job lock, where they have insurance at their current position and they realize they won't be able to get it outside of that position, so they can't move around in their career, they can't change positions, they can't, and a big part of that is that they can't go out and start their own business. So being able to access coverage is going to be huge for folks and entrepreneurs to move around, and also for small business owners, folks who are working at a job that they're unhappy with or a bigger business or whatever, and they want to move, but they can't take that risk of going to a smaller company and losing that insurance that they have.
I'm not working just for health insurance. I love what I do, but it's definitely, I'm glad I don't have to worry about that, because it would be, not everyone gets to work with what they love to do. And so if I had to make a decision between health insurance and work happiness, it'd be a huge dilemma. Luckily, I don't have that problem.
For Stay Tuned, this is Margaret Enright.
Okay, so we're back at the table. This week our community roundtable, if you will, is also, it is comprised of small business owners. Let me do introductions first. Frank DeGraff, You might know him from Count On Downtown at the website, but that's not your full-time job. You also do some translating, some consulting, you're working internationally, but you're working for yourself.
That's correct.
Nate Johnson, Real Estate Solutions. I think that speaks for itself. And Brian Poznansky, Traffic PRN. It's an online marketing agency. You're working for yourself as well.
Indeed.
A couple of things that Lou said there in the piece I want to ask you about. The lack of health care can be stifling to entrepreneurship. Does that resonate with you gentlemen at all?
You know, I think it depends on what kind of entrepreneur you're talking about. If you're talking about a self-starter, it might, if they're married and they have kids. I find there's a divide, people under 30 and people over 30. I'm still amazed at the number of 20-somethings who are happy to say, I don't care if I get hit by a car tomorrow, I'm going to go start this business. Now, people like me, a little bit longer in the tooth, you've got responsibilities, you really have to think about it. I was really struck by something that Chris said in the previous panel when there are lots of unknowns, but the biggest unknown is, will these exchanges create competition and drive down the cost of group health plans, drive down the cost of premiums? Last year, for instance, our healthcare premium was the first year it did not go up more than 15%. We did jumping jacks. It was great. So that's the key question for me. And I think the key question, I think for the individual entrepreneurs, entrepreneurialism is a huge issue here in St. Louis. There needs to be more of it. Hopefully, the ACA and the private exchanges will solve more of that problem and just take the issue off the table.
Yeah, Casey, I think that, it absolutely stifles innovation. With the way that our current healthcare is delivered, it doesn't make sense. A lot of folks have those golden handcuffs, as I like to call them, to their corporate jobs, and they don't have the luxury to take a risk to go out and start their own company or to go work for someone who isn't in a position to offer health care. For me, I'm a small business. I have forget well under 50, I have well under 5 employees and several independent contractors. And it's just not realistic for me to be able to offer health care to the people that work with me. And my wife, thank goodness, is employed, and my health care comes through her. So without that, I would probably, be in corporate America somewhere working, and I wouldn't have the opportunity to, enjoy the real estate career that I have with a small business.
Yeah, and I think that's really what the ACA is trying to do. It's trying to bring the people that are now outside the system back into the system. Actually, 20 people in their 20s are the largest group that are uninsured, even more than children, because they say, I'm young, I'm healthy, I'm not going to get sick, why would I spend a few $100s a month on something I don't need? And the Affordable Care Act is trying to bring this whole group back into the pool, but they have to pay into the system as well. If all the low-risk people, the young and healthy people, are not in the system, then the system is broken, because then it's all the older people, the people that get more sick, that usually take more out of the system than can afford to pay into the system. And that's what the Affordable Care Act is really all about. It's about bringing everybody back into the system. And that's basically the basis of insurance.
We heard Lou say he called it a gamble, but he said it was worth it for him and for his business. Is that a widely shared view among small business owners?
Well,
to provide for their employees?
I think it's all relative. It depends on the position of that particular business. And, small business, I think that when you talk about 50 employees, it's a lot of employees to have. That's not in my definition of a small business. And I think that, our economy is built on really small businesses that are starting out with 1 to 2 to 3 to 4 employees. And hopefully at some point they'll grow and get to a place where they have over 50 employees. But it's just very difficult for a small business employer to cover that, because you've got such a disparity in what the cost is going to be. It would be less expensive for me to hire a male employee versus a female employee based on healthcare when I'm dealing with 1 person or 2 people. So it's very difficult to offer it in general. And when you're comparing that to some of the larger companies, they have this huge pool, and that's where these exchanges are going to come into play, because it does allow individuals to get reasonable healthcare rates where their rates are not not specifically determined based on their own health history, but the collective pool.
I would say, and to your point, Nate, I think, what type of small business are we talking about? Restaurants, small boutiques, small retailers. I think there's a conditioning out there that people who work for those businesses, they don't expect health care. Now, in my industry, we're shooting for young talent. We're looking for digital natives. We're looking for people who know social media. That's professional services. When you're talking professional services like small law firms, small marketing firms, small service firms of any kind, there's an expectation that that's a real job maybe, and they're expecting health care. So I don't get too far along in interviews before the healthcare question comes up. When you get to the business end of things of what's the compensation, what are the hours, what's the healthcare, it's definitely a top 3 question. So whether they're 22 or 52, I think in some industries that question is always going to be on the table.
Yeah, but that's a good point you're making. You say people in the restaurant industry, they don't even expect health insurance. We're United States of America. We're the number one. We want to be number 1 in sports. We want to be number 1 in the military. We can be number 1. We can provide universal health care for every U.S. citizen. We can do it. If you look at, for instance, the UK, we spend $8,200 a year per capita on health care. It's about 18% of GDP. The UK, they have a government-run system. They spend $3,500 per year. And they have universal health care, less than 10% of GDP. So, and
of course, if someone were here that didn't like that, they would say they're not getting the same care, but that's another debate, perhaps a whole other show for starting there. But go ahead.
But 33 of the richest countries, 32 of the 33 have universal health care, and we're the only one that doesn't do that right now. And I know we can do that too.
Well, go ahead, Nate.
Well, I was just going to say, just the whole way that the whole way that healthcare is delivered in our country. If you were to design a model today, you would take healthcare out of the hands of the employer. The employer would not be the person that's providing that, but because that's the way that it's occurred for the last 100 years or however, that's how we continue to do it. And hopefully, Obamacare may work towards getting us away from the employer-provided health care, where you've got more, more of these exchanges around where people have their own individual health coverages, so they're not coming in the door with the expectation that, I have to have the employer providing that health care for me. And when you look at our state, when you see legislation being passed, which gives certain employers rights to deny coverage or not offer certain types of coverage based on, beliefs and things like that. I mean, I don't think that that's where we want to be. I don't think that any of us want to have our employer telling us, what we should and should not do as it relates to the type of health care that we want.
We just have a few seconds in this section, but I want to ask real quickly, how confusing is it for small business owners? What's coming in the next year, the next 2 years with this law? We seem to establish in the last talk that it was
right now it's
clear.
very confusing because there are a lot of unknowns. Even the experts you talked to earlier, we still don't know how it's exactly going to work with these exchanges. Is the cost going down right away, or is maybe the cost going up first before it's going down? It's a lot of unknowns.
All right. Well, thank you all. We have to stop here, but I want you to stick around. We'll come back to the end of the show as well. I think some of what you said may spark some interest and some comments on social media. Let's go back to Twitter. All right, let's take our show on the road across I-70 to Kansas City. We're going to speak to a woman by the name of Andrea Ruth with the Missouri Health Advocacy Alliance. Andrea, thank you for joining us. We appreciate you being here with us on the Google Hangout. We've heard a couple of terms tonight that I want you to give us a little more explanation on. The first being job lock. I know this is something you study. What are we talking about when we say job lock?
Great question. So You know, a lot of us stay in our jobs. We're locked into our jobs, not just because of the pay or the type of work we're doing, but many of us are in those jobs because we need the health insurance, or someone in our family needs that health insurance. And in 2004, there was a study done that showed that 27% of the people they surveyed were staying in their jobs because they needed the health insurance coverage that that employer was providing for them. So people get locked into their employment situation. They don't do things like we were talking about earlier on your show. People have ideas for great innovation. They want to be entrepreneurs. They want to start their own businesses. But because of a health condition, they're locked into that job where they are now, and those kinds of innovations never happen. So the Affordable Care Act gives us an opportunity to actually break out of the job lock and have some people be able to have health insurance coverage, but follow their dreams, start new businesses, you know, create those innovations that we want in our society.
We heard Lou in the package from Vintage Vinyl, and also our business owners around the table talking about healthcare as a tool for recruitment. In your work, do you see healthcare as that kind of a tool for not only recruitment but also retention?
Absolutely. And you know, hitting on retention, it's very important. A lot of employers know that the cost of you know, finding new employees when someone leaves and then training that new employee adds to the cost of their business and the cost of doing business. So they prefer that people be able to stay where they are. And that's why a lot of small business owners would like to be able to provide coverage. People we talk with are excited about the tax credits that the Affordable Care Act offers small businesses who want to provide insurance to their employees, be able to keep them, and reduce some of those retention costs that they might have if people left.
Okay, so what if you don't work for a small business? You don't own a small business. You're perfectly happy working in corporate America. There's nothing wrong with that. Does this have an effect on my life if I don't fall into any of those categories of small business?
If you're in an employment situation where your employer's providing coverage now, and many large businesses are, and they provide coverage in what we call a self-insured form, which means the employer's actually carrying the risk of providing you some coverage. If you're in that situation, you can stay in that situation. The Affordable Care Act doesn't change that, and we think that many large employers will continue to provide coverage for their folks.
And help us understand, what is the difference in terms of what a larger employer is up against versus a small business? You know, presumably, if you're trying to insure more people, it's going to cost more money. Why is it easier? Why is it so much harder? Why is the attention on the small business?
Yeah, that's a great question. So large employers have had an advantage in the current marketplace before the Affordable Care Act because they pool the risk of their many employees and they go negotiate with insurance companies. They're able to keep rates down. They can spread the risk over a larger pool of people, their employees. So, you know, it helps to keep the premiums down, and also those insurance companies are able to negotiate sometimes better rates with providers as far as the provider reimbursement when those employees are sick. So large employers have had this advantage, if you will, for many years. Small businesses, on the other hand, don't have that kind of buying power. And the Affordable Care Act seeks to help them have that buying power through the exchanges where small businesses will have their risk pooled, be able to have that same kind of negotiating power with insurance companies, help to keep the rate down and spread the risk over a larger pool of people.
So if it's going to do that, why is there so much skepticism amongst small business owners?
Well, I think some of your earlier guests hit on that. And, you know, there's been a lot of misinformation about the Affordable Care Act in our country and in our state. Change is hard for people. You know, we're about to enter an era where people have to make changes, but where we were going in healthcare and where small businesses were going in dealing with healthcare coverage for their employees was not sustainable. Most small businesses were really struggling to be able to provide that coverage for the people that they know very well. You know, a lot of small business owners like Blueprints, they know their staff, they know their families, they want to be able to provide that kind of benefit, and they've been struggling to do it financially. So now they're going to have the opportunity to provide that kind of benefit to their employees and really do what they wanted to do in the first place. But we're in a transition time, so everyone's, you know, a little bit nervous about what this is going to look like. I think after 2014, after the first year of open enrollment in the exchange, we're actually going to see a lot of people understand that it's a good thing and that it's something that's going to help small businesses and their employees and those families.
Do you see Medicaid expansion or the lack thereof playing a role in this discussion we're having?
Absolutely. You know, many people don't know this, but in Missouri, our Medicaid eligibility level is extremely low. And I mean, like, if you're a young mother and you only make $3,500 a year or less, you won't qualify. You will qualify for Medicaid, but if you make $3,500 or more, you're not going to qualify for Medicaid. So we have a lot of low wage workers in our state who will benefit from the Medicaid expansion when it is finally passed by the Missouri legislature. Many of the people I talk with are folks who work maybe 2 jobs, and they're really trying to put food on the table, pay their rent, pay their utilities. They have a lot of trouble affording insurance coverage. Their employers don't tend to provide. Someone mentioned restaurants earlier. Those are the kinds of businesses we're talking about where they don't tend to provide healthcare coverage. Their workers are not making enough money to buy coverage on the individual insurance market, the private market. So the Medicaid expansion is designed to really help those kinds of low wage workers afford some sort of coverage.
And just to be clear, it has not passed in Missouri, and the chances are pretty slim at this point, especially in this session. We have to leave it there. Yes. Andrea Ruth, thank you so much for being with us from Kansas City, from Missouri Health Advocacy Alliance. We appreciate your time. Let's pick it back up with social media to see what you're saying at home.
Now we're eyeball to eyeball.
We are indeed. Let's have a discussion eyeball to eyeball here. I'm with Jim Brassfield with Webster University, Professor of Management and Health Services. So I have a couple of questions, but first I want to ask you, I see you've jotted some things down. What's stuck out to you tonight?
Well, I thought this was a great discussion. I thought the wide range of people brought up all the various issues that are associated with the final implementation of the Affordable Care Act, and particularly how it's going to affect one of the critical key constituencies, which are small businesses, and the complexity of the law itself is a problem, and that was expressed. A couple of the participants said that small businesses are kind of overwhelmed. They don't have a lot of administrative capacity, and they're feeling they're going to be overwhelmed by just all the administrative complexity of trying to meet these provisions. And the law itself is complex. Chris Risker pointed out that this is going to be a hard law to implement because it is complex. And if we look at a recent example, the Medicare Part D that came into effect about 10 years ago, if you remember, when that was first implemented, there were all kinds of computer problems and people showed up at the pharmacy and they weren't on the list and so on. And I think we would be foolish not to think that this much more complex law isn't going to have similar kinds of problems. And I'm sure we'll see lots of newspaper stories about how the computer systems weren't working and people couldn't get hooked up with insurance and small businesses were miscategorized and so on. So I think we can expect that there are going to be some rough patches as the law begins to be implemented in 2014. But again, if the Part D is any example, now you don't hear that. That in a year or two they straighten those things out, and I suspect that we're going to find the same thing. That in 2016, people will look at this in a much more positive vein because the implementation problems will be behind us, and hopefully, when things come up that need to be fixed in terms of the law or in terms of the process, that the federal government and the states will figure out a way to fix it so that it achieves what I think everybody wants to do. I mean, you didn't really hear anybody on the panel that said, we don't think people ought to have health insurance, or we don't think people ought to have the kind of financial protection and income security that comes from having health insurance. And it's the question has been for years now is how to do it and who pays for it. But I think there's not the, I don't hear anybody saying, oh, small business employees shouldn't have health insurance. It's not something that they should even want to have.
Change is hard, our last guest said. Something we've seen on Twitter and elsewhere getting ready for the show, a concern that small business will become overly reliant on government. The very people who have that independent streak in them, and that's what makes them work, have all of a sudden an extra layer of government in their lives. Do you see that as a factor here?
This is the central debate in healthcare policy now in the last several years and going forward for the next several years, and that is the role of government. Frank mentioned the British healthcare system that is a purely public system, and we're not going there. We're not going to have that. That's not acceptable. On the other hand, we're not going to go back to 1930 before the start of Blue Cross and before the start of government role, where everybody, you paid the doctor with pulled the money out of your pocket, or if you were poor, you gave them a chicken or something like that. I mean, we're not going to go back to that system either. So, and currently, about half of all money that is spent in the healthcare system is raised through taxes. Medicare, Medicaid, the Veterans Administration, and so on. That's not going to go away. That's not going to change. So, government is going to have a central role, and the debate that continues to go on over the Affordable Care Act and over Medicare and Medicaid is how much of a role should government have, and some segments of the population think the role of government should be more, and that would be an improvement, and others think that we need to lessen. But I think no one believes that suddenly government is going to go away. So the trick is to find the proper balance and to have government play the right kind of role, but not to overwhelm small businesses, big businesses, or individuals.
Jim Brassfield, thank you from Webster University. We appreciate your time and for your insight. Stick around, don't go anywhere.
Okay.
We've got to go back to Ed for an update on what's happening online. Ed.
Thanks again, Casey. Well, there's been a lot of activity on Twitter and on Facebook tonight, and mostly around this, the confusion and a lot of what is going on, and people want to know more. So keep those tweets going, keep your questions on Facebook, and actually join us. We have an after show. We want you to log on to 9net.org/stay tuned. Jump in after the show. We have this really great after show. We will bring all our guests and experts back to one big table. So let's hear what you're continuing to say on social media.
Okay, we're pulling back the curtain on the post show for you tonight. Oftentimes what we do is we stay online, as Ed just mentioned, and on Twitter folks tell us the post show can be better than the actual show. I don't know if that's a compliment or not. So we'll try to replicate that environment here. And the way we do it on the post show is we really just kind of open it up as a free-for-all to say, when did I cut you off and you wish I wouldn't have? So let me do that, and we'll get the conversation going that way. Who I think I can remember looking directly at you and getting the rap at the same time.
There was one point that came up in the first panel and then in our panel, and I think if we're talking about, there's a lot of uncertainty, but if we're talking about pain, I do think that swath of small business between 50 and 100 employees, I'd be a little bit concerned about them. Because there's a lot of uncertainty there. Now, somebody like me with less than 50 full-time employees, and the vast majority, I don't know what the exact percentage, 80 to 90%, I think, of small businesses in this country, 28 million small businesses, they have far fewer than 50 full-time employees. But so that's a question mark. But again, I go back to the key thing, and I would agree with Frank on this. If we can get more people into the system and drive down costs for everybody, it means driving down costs not just for the individual, but for business, and getting this burden. I will always offer health care to my employees as a small business owner. I would like to see those premium costs go down.
I'll offer a thought on costs since we've focused a lot on that. There's a lot of evidence out there that the real driver of costs is the provider system and the lack of integration and the silos in which they operate. And it's not only costly, it's bad medicine too. And again, that's one of the hopeful signs of the Affordable Care Act, that it really is trying to change the delivery system through Medicare especially, trying to encourage these development of patient-centered medical homes and accountable care organizations. But the idea is, until you change the delivery system, cost isn't going to change. And the evidence is that the real cost drivers are the dominant hospitals and the dominant physician networks that drive cost. A study in Massachusetts showed that was the real driver of cost in healthcare.
And there's a high degree, I mean, studies have shown that there's a fairly high degree of concentration now in many urban areas in hospital systems, and there's also a concentration in the insurance industry. So, you know, if you're depending on market competition to lower cost, and you have a couple of hospital systems negotiating with a couple of insurance companies, neither party is going to have a real incentive to strike a hard bargain, and both parties are likely at the end of the day to try to pass the cost back to the lack of concentration, which is the consumer, and especially, I think, the small business consumer, because if you have large businesses, they're self-insured, and they are large and can exercise leverage through that. So it's the small businesses, and I think that's one of the hopes of the Affordable Care Act, is that by bringing small businesses together into the insurance exchanges, they will be able to negotiate. Now, if the exchanges don't work as they should have, or that the system gets clogged up, then it's not going to work like that. But I think if the small business exchanges work, then hopefully the small businesses will begin to, in this system of lots of giants, the small businesses need to play that game. Otherwise, they and their employees are going to be at the short end, either not having insurance or having it so costly that it hurts the business.
And I think one of the sorry, go ahead.
No, I was just going to say, I think you said something that's really important that we sometimes lose when we talk about, who's going to drop out, who's going to not hire the 50th employee. What you said was, I'm always going to offer health insurance to my employees. And as a consumer, that's why I like to shop at small businesses, because they do value their employees. I know a lot of small business owners who say the same thing that you do. The reason they pay the high costs now is because it's the right thing to do by their employees. I think we're going to continue to see that, which is why I'm excited about an attempt to make things more affordable for small businesses and less concerned about sort of, what's going to happen, who's going to do what to try and cheat the system. I think most people want insurance, and I think most small businesses want the opportunity to provide that to their employees.
Well, I would say, though, to that when you say you'll always offer insurance to your employees, I mean, that's a really wonderful thing to say until maybe you get an 80% rate increase, right? So I think that, there are a lot of small employers who intend to continue to offer insurance. They may not find it feasible to continue to offer insurance. I believe that for small employers, particularly ones that fall under that penalty threshold, are going to be looking very closely at new different types of delivery systems for benefits, like defined contribution models, which is not something that we've really touched on tonight. But in a defined contribution plan, you give your employees the choice, often through buying individual policies where the business is making a decision, a financial decision, about how much money they want to provide to the employees, and then giving the employees the flexibility of deciding, do they want to shop in the private marketplace? Do they want to buy something through the exchange? What kind of a policy they want, what kind of a company do they want to buy it from?
We'll give the last word to our other man from Webster. We're just about out of time, and then we'll have to say goodnight.
Well, I guess I would look in other places for some of the costs that's hitting our healthcare system. I'd look at the chronically ill, for example. We're able to keep people alive for longer periods of time with chronic diseases. I think I'd also look at some of our administrative costs, particularly as it may exist in our billing systems, which are very complex and competitive. And we have very expensive software that drive those.
Okay, lots of good stuff. We'll keep talking about it online. Thank you very much for watching. Stay tuned.
Art by the Missouri Foundation for Health.
What are the issues that are important to you and to the St. Louis region? Share your insights. We want your ideas for a future episode of Stay Tuned. Call 314-512-9009 or email us at staytuned@ketc.org. Would you like to be a live audience member on Stay Tuned? Email us at audience@ketc.org. What were you saying?
Well, I was just saying that she brings up a good point. I mean, it's hard for anybody to predict. I mean, an 80% cost increase, I'm like, wow, I hope there's not a war going on. But it's hard to predict that. But, from a practical standpoint for me, I hire employees. They're young enough where they're still on their parents' plan, or they have a spouse who works for a large company and they have a great plan and they don't have to worry about it, and they and their children are on their spouse's plan. So as a business owner, I look at that and think, well, zowie, that works for me, but as we grow and add more people, I'm not going to have as many options. So
that's interesting. That's affecting your hiring decisions, whether or not they have their own insurance that they're bringing to the table.
I will always hire talent first. Okay. In my industry, I'll always hire talent, but healthcare absolutely is part of the conversation. It's got to be part of the compensation package, so it's something I always have to think about.
And see, I think that's where the wheels kind of fall off, and that's where it's really stifling innovation and entrepreneurism in our country, because that should be one thing that can be taken out of the equation, or should be taken out of the equation, because you already have a lot of decisions that you're going to make if you're thinking about starting your own company or going to work for somebody else. Financial implications are there, and then you've got this whole nebulous insurance issue. Am I going to be able to get good coverage? How much is it going to cost? I know in a perfect world it'd be great to say for every single person the cost for health care is this much per month, no matter if you're 20 years old or 50 years old, work for a big company, work for a small company. You know what that is, you know what that cost is, and you can act accordingly.
Even if it was more?
Even if it was more.
Even large companies don't know what those are and are concerned about their costs and feel that healthcare adds that much more expense to their product, and so they are less competitive on the world market. My dissertation was in that area, and I talked to a lot of business leaders, particularly in the Colorado area, and Bill Coors being one of them. And he complained bitterly about that. He was saying, I have to add my healthcare costs to the cost of my beer, and that makes me less competitive throughout the market. So I would also add, in terms of their setup there, of course, they probably had the best fitness and wellness center I've ever seen in the corporate sector. Yeah. Well, you know, yeah, they had Coors on tap in the wellness center, and
it was easy to get a six-pack. Is that the joke you just made there at the wellness center?
You know, it was a hot day when I was visiting, and you know, it was a pretty good product.
Did it make it into the Affordable Care Act?
No, it did not. Yeah. No, yeah, it didn't make it.
By the way, these are helicopters. Military training is going on outside. I doubt the mics are picking them up, but I know everyone here is wondering what's going on. Okay, so that's,
whether we're being invaded or
we
not.
are not. Right? That is a couple of days of training going on at the National Guard.
As long as it's not a drone.
Exactly. Okay. That, all right. The topic for next week's show. We'll write that down. Margie, how are we doing on time? I don't want to run us over. 3 minutes left. Go ahead, Nate.
You know, I was just looking back. At one point, I did look at providing health care. You know, I had an assistant, and, you know, I looked at that, I was like, well, you know, you've been here for a while, let's see what this costs. And the cost was just, whoa. It just didn't make sense, you know, for the wages she had. It was an entry-level employee, and to offer to pay for the health coverage on top of it, it just didn't make sense.
But
you know, it didn't work.
Yeah, if you can go into an insurance exchange and even purchasing for 1 and 2 employees, you're part of a group of thousands of other small business, then whatever the differential today is between trying to purchase for 1 or 2 employees in a small business as opposed to a large business, if that begins to disappear, it's still not going to be cheap. You know, I mean, the average cost for a family policy today is $15,000, and that's not cheap.
But level the playing field.
But it would make it, you know, it would level the playing field some.
I think the other piece is that if you are a business that can't see your way to afford health insurance for whatever reason, your employees are going to have options that they just don't have now. Right now, if you are unable to get it through work and you have any kind of pre-existing condition, good luck finding any insurance that you can get. So that's the big piece for employees, is that if you don't get it through work, at least there's going to be new options that people just have never had before.
Now we're down to 1 minute again, just so you know. And we don't want to.
Final thought. It struck me as everyone talked about small business that's a generic category that includes lots of different kinds of organizations. And I think sometimes, you know, we lump the restaurants and the small law firms and the computer firms and so on all together as small business, but they're all have different kinds of financial arrangements and personal arrangements and so on. And maybe just in that sense, maybe just the term small business is kind of hurting us in terms of trying to figure out a way to do what we're trying to do, which is to make sure everybody can get affordable health care.
That sounds great. We'll leave it there. Thank you very much. Thanks all for all of your time. We appreciate it.
Thank you.
Okay.
Thank you. Thanks for making us smarter.
Health-related programs on the 9 Network are supported in part by the Missouri Foundation for Health.